distinguished ladies and gentlemen, permit me to acknowledge and express my sincere thanks and appreciation to the organizers of this conference, which I know is African Empowerment Council, the Peace and Island Institute, and the West African Society. Let me thank them for inviting me to talk on a topic I'm very passionate about, that is the empowerment of women and education. I've always espoused the principle that it is through education and economic empowerment that women can enjoy their full empowerment and gender equality. Women will love words like enjoying their full potential. Education in particular allows a woman to make choices in life and take care of her family. There is no doubt that an educated woman or a highly successful woman is listened to by everyone. I'm therefore heartened that women's empowerment is being matched with education, because this is the only way forward for women all over the world to attain full empowerment. In Sierra Leone, women make up almost 52% of our population. However, this representation fails to be reflected in key areas such as in decision-making, literacy, and economic empowerment. Though some strides have been made in areas such as representation in government, many issues such as gender-based violence, discrimination, harmful traditional stereotypes remain, which no doubt deter women's empowerment. Majority of our Sierra Leonean women are illiterate and poor. National surveys show that women play a significant role in society, not only customarily as primary caregivers, but women who also make majority of contributions to development in terms of economic well-being and food security. Women account, thank you. God bless. Women account for a large proportion of the working age population and make up the largest proportion of the labor force. Furthermore, women comprise 32% of agricultural workers, a sector which employs 50% of the total population. The evolution of women's role in society lies at the root cause of their stagnation. Women in Sierra Leone are mostly represented in the informal sector, such as market women, petty traders, or rural farmers, and most of them traditionally are confined to roles of being a mother, wife, or caregiver of some sort traditionally. For women to achieve empowerment, we must be able to question traditional norms and to deal with potential resistance to change by both men and women. Your Excellencies, distinguished ladies and gentlemen, as you are aware, the Mano River Union region has been in the throes of an Ebola virus disease outbreak since March 2014. That affected the republics of Guinea, Liberia, and Sierra Leone, in which women have been disproportionately affected by this terrible disease, largely because of their traditional roles as caregivers in their families and communities, and as frontline health workers. According to a gender assessment undertaken by UN Women in December 2014, 56.7% of females were affected by the Ebola virus disease compared to 43.7% men. This accentuated the socially prescribed norms and behavior that perpetuate gender inequality. The women of Sierra Leone are also underrepresented in both the public and private sectors. For example, we only have one female minister in cabinet and about 4 female deputy ministers. Only 16 out of a total number of 136 members of parliament are female. Sierra Leone can only boast of a handful of female heads of parastatals and even fewer chairpersons of parastatals. The situation holds true in the private sector, with only one female managing director of a commercial bank and one female head of an insurance company. We are rising in the judiciary. Sierra Leone has had its first female Chief Justice, who just retired a few months ago. The Supreme Court, however, has one female judge, whilst the Court of Appeal has 2 female judges. Women have been elected as paramount chiefs in some parts of the eastern region and the southern region. However, women have not been eligible to be elected as paramount chiefs in certain areas in the east of Sierra Leone and the entire northern region, based on traditional beliefs and practices that are permitted under our old Chieftaincy Act. Women living outside Freetown, the capital city, have unequal access to land and property, where customary law favors the male child with regard to inheritance. Unfortunately, the discriminatory provisions in the 1991 Constitution of Sierra Leone, as described above, allow discrimination against women based on customary laws and practices, and these provisions deter the full empowerment of women. President Ernest Bai Koroma has taken the lead more than any other sitting president of Sierra Leone to appoint more females into positions in cabinet, parastatals, the judiciary, and in the foreign service. Yet, Sierra Leone has still not enacted an affirmative action bill that will reserve a 30% quota for women in the area of political participation. A women's empowerment and gender equality policy is being prepared, and it is in the final stages of adoption. The policy will, to a large extent, call on government to make greater strides in achieving women's empowerment and gender equality. A women's empowerment and gender equality bill will be drafted immediately after the adoption of this policy in order to consolidate its gains. The government of Sierra Leone has passed into law several bills that support women's empowerment. They include the Education Act of 2004, Anti-Human Trafficking Act, Sierra Leone Citizens Amendment Act 2006, Prevention and Control of HIV/AIDS Act 2007, Child Rights Act, Devolution of Estates Act 2007, Domestic Violence Act, Registration of Customary Marriage and Divorce, the Legal Aid Act, and the Sexual Offences Act, and so on, to name a few. However, more improvement needs to be made in the area of legal reform. Sierra Leone is in the process of reviewing its 1991 Constitution, and there are strong calls for the expungement of sections that are deemed discriminatory to women and the removal of sections that disqualifies women as candidates for chieftaincy, especially in areas where it is based on tradition. There are also calls for the acceleration of the abortion bill, the enactment of the criminal procedure bill, which will inter alia expedite criminal proceedings in cases of gender-based violence. An employment bill will also allow for equal pay for equal work for equal value, and the matrimonial causes bill that covers all types of marriage, including customary marriages, and guarantees equal rights in marriage in the distribution of property in divorce proceedings. A good number of policies and strategies have been adopted which will enhance women's empowerment. And the list goes on. It's very long, but those of you who know know what I'm talking about. Although the government of Sierra Leone has prepared a draft land policy, it still falls short of providing women with the right to freely own and dispose of land like men. The discriminatory provisions in 1991 Constitution of Sierra Leone that are mentioned above have resulted in women's unequal access to land outside Freetown, the capital city. Now, young girls and women still have unequal access to education. Before I come to education, there is a law in Sierra Leone which is stated in the Constitution. There is the doctrine of equal rights and adequate educational opportunities for all citizens at all levels, by ensuring that every citizen is given the opportunity to be educated to the best of his ability, aptitude, and inclination, by providing educational facilities at all levels and aspects of education, such as primary, secondary, vocational, and technical, college, and university. However, the Constitution is silent on early childhood education, although it does not preclude it. I'm sure it was not appreciated in those days. People did not put any value, or they did not think a child can go to school before the age of 6 or 8 in those days. So early childhood was out of the question. Yet young girls and women still have unequal access to education. There are approximately 1,584,586 students in school system, primary, secondary, and senior secondary school in Sierra Leone, of which female students account for 48%. At the primary level, female students account for 49%, resulting in parity in access to education for boys and girls. However, the disparity becomes stark at secondary school level and in tertiary institutions. Early marriage and teenage pregnancy have resulted in the dropping out of female students at secondary school. In other circumstances, there is simply a low enrollment of girls at the secondary level. There is a Child Rights Act, and then some of the challenges girls face at school, sometimes this is stated by UNICEF, is sexual abuse by both their peers and sometimes some teachers. However, UNICEF and other partners have worked assiduously with government of Sierra Leone to develop ethical protocols that protect school-going girls from sexual abuse and other forms of gender-based violence. The 2009 Code of Conduct for Teachers and other educational personnel addresses issues such as sexual exploitation and abuse of girls in educational institutions. There is also a challenge of insufficient sanitation for girls at school. Nonetheless, the government of Sierra Leone and its education sector partners are not only ensuring safe environment for girls, but are constructing separate sanitation facilities for girls. An equitable proportion of female teachers are being recruited in primary schools. Gender-sensitive curriculum are being developed in schools, and teenage and adolescent and high school dropouts are being encouraged to re-enroll into formal school system again. Technical and vocational schools are also open to young girls who want to opt out for this. I'm going to talk about my interventions as First Lady. I've given you what the situation is like in Sierra Leone. Since my inception into the office of the First Lady, I've been engaged in a series of activities to promote women's empowerment. More particularly, my interventions are in the health sector, have boosted the women's empowerment in Sierra Leone. Firstly, the Women's Initiative for Safer Air contributes strategically to the reduction of maternal and child morbidity and mortality by focusing on the urgent need to change people's lives by offering them better health choices, better access to health facilities and training for health workers operating closest to the areas of need. Also in the area of health over the last 5 years, I have provided unwavering support to the campaign on the accelerated reduction of maternal mortality in Africa, which my work has been funded by UNFPA and the Ministry of Health and Sanitation in Sierra Leone. This initiative is designed to create awareness, increase in knowledge of paramount chiefs, religious leaders, women, and youth groups about making the right decision with respect to reproductive health. Under this initiative, Kama communities have been established in almost all the districts in Sierra Leone. Traditional and religious leaders have been encouraged to use their networks, and in the case of paramount chiefs, to issue chiefdom bylaws that require women to deliver babies at health facilities or birth waiting homes. I don't know how long you want me to go. Can I go on? Where are the other nurses? You have not told me how much time. 5 minutes, okay. Okay, all right then. So I've been a campaigner on the reduction of teenage pregnancy and early marriage in Sierra Leone. When the policy was enacted, I even had a sister in the sub-region, Mrs. Goodluck Jonathan, was invited to Sierra Leone to launch my campaign on the reduction of teenage pregnancy and early marriage. That was rolled out to all the provisional towns of Sierra Leone. In the area of HIV, my office has been working with, as a member of OFLA, we've just received about 4,000, it's called the rapid testing kit for the prevention of mother-to-child transmission of HIV. This is called the DUO rapid test kit, and that is going to be tested and implemented. It has already been tested as soon as we get to Sierra Leone. Once again, in the area of women's empowerment, in close collaboration with the Ministry of Social Welfare, Gender and Children's Affairs, my office has designed a Women's Empowerment and Gender Equality Program, WEDGE, that complements the government of Sierra Leone's agenda for prosperity. Under the WEDGE program, my partners and stakeholders are designing and implementing projects that cover the following thematic areas: advocating for policy and legal reform that will promote gender equality, strengthening women's political engagement in leadership, governance, and decision-making, promoting women's economic empowerment, including women in cross-border trade. Under this component, I've requested the African Development Bank to provide funding for cross-border traders in the Minority Union. And I have been honored with $500,000 grant to be given to MRU Secretariat in support of women in cross-border trade and smaller associations and entrepreneurs. Promoting girl-child education, especially for the completion of tertiary level education. I've also been giving scholarship to girls to stay in the sciences, to do maths, which is not fashionable nowadays, and sciences. I'm encouraging girls' child to stay in the sciences because it will help their critical thinking and make them better spouses in future. In the area of women's economic empowerment, I joined my dear sister and friend Sherry Blair in launching the organization of Women's Network of Entrepreneurs Owners, a network of women's entrepreneurs. And I have donated a freezer truck to a rural village in Kabbalah to ensure the preservation of perishable fruits and vegetables, but also to ease the transportation of fruits from this district, which represents one of the bread baskets in the country, to Freetown, capital city. During the Ebola outbreak, I undertook some gender-specific activities in view of the fact that women were disproportionately affected by the Ebola outbreak, as I mentioned earlier. With funding from UNFPA and in partnership with religious traditional leaders and secret society in Sierra Leone, I convened an advocacy meeting on the 21st August for stakeholders from all walks of life entitled The First Lady's Response to Ebola Using Reproductive and Gender Lens in Britain. The purpose of the advocacy was to reinforce official public health messages and to look into behavioral changes in religious and traditional places. Further, meetings were held in different parts of the country. Through the Mano River Union First Ladies Initiative, we came together to see how we could strategize, integrate our approaches, harmonize our activities in the sub-region. So we've started revamping our hospitals, encouraging, because after the Ebola, all our potentials have been reversed, all our gains have been reversed. Now we are starting from first principles to encourage people to go back to hospital. Doctors and nurses are even afraid to work in the hospital environment. Patients are afraid because they think that is the place they would get Ebola. So I'm on a mass drive, revamping hospitals, going to the rural places, encouraging them to use hospitals. But at the same time, I'm working with the medical team to train personnel in infection control, which was one of the causative factors of us dying, because the Ebola came at a time where most of our nurses were not trained in infection control, and designing hospitals to have a triage system where you can separate people with infectious diseases. So it has not been an easy time for us in Israel. So, to say the least, I've been a busy bee going all over the place, and education for me is the key to success. I have what is known as my Flaxseeds program, First Ladies Attitudinal Change in Schools. There I looked at behavioral change of the young, because we have interdynamics playing between the old generation and the new generation. It has been instrumental in focusing minds on the needs of young people within the educational system, drawing on their ability to absorb messages and learning about such life-changing experiences. At personal level, I have engaged in a range of activities under this program, including curriculum development, and at present I'm trying to publish a book that we have written on attitudinal change in schools. I've been interacting with school children, going to school, talking to them on a one-to-one basis, inspiring them to remain in school and attain good grades. So Flaxseeds is ongoing, and through Flaxseeds I've been providing scholarships to all levels of students, from primary, secondary, tertiary, and vocational institutions, which I intend to maintain all throughout my life. To date, I have provided up to about $800,000 worth of scholarships during my 8 years tenure as PCA. If I can conclude, if I have a dream, is to leave Sierra Leone with a proper school of excellence and a basic rural hospital which will model all my interventions and narrow the gap between urban and rural life. So I want to express my sincere thanks to Women's Empowerment and Education, those of you who have organized this comment, and I want you to know that I will do everything within my interest, within my powers, to support you. I thank you all.